Yeah, so we're rolling.
All right, so Donna, how long has it been since your last seizure?
It was, I can tell you what day it was on. It was March 10th of 1969, which is a little over 42 years ago.
And how would you describe the sensation right before a seizure hits?
I had a lot of points of injury in the brain from the encephalitis, so I had multiple auras. A lot of times it was sensations that I felt mainly around my face and sometimes in my heart. And
How do you describe these auras?
Just something that was clearly odd happening, and I knew it was odd. I had light flashes in the peripheral of my vision on some of them, which I felt were occipital oriented, and then I had sometimes rushing thoughts that I could not stop, that were overpowering, and often had a bent of either anger or fear associated with it.
And in your worst state, how many epileptic attacks were you having on a daily basis?
I had quite a few initially. When I came out of the hospital, I was having on an average of 10 a day because my brain was very sensitive to light and sound. And
how has that affected your social life back then when you had so many seizures a day with your family and your friends and your social life going out? How was your life back then? Can you talk a little bit about that?
I had been a normal and maybe highly performing student. I had lots of friends. I had been recognized already in my life as a humanitarian. And so I had a wide circle of friends, but within 3 months of coming home from that illness, my friends quit coming around, and I, never saw them again.
So how were you feeling at that time when you felt hopeless that there was no solution for epilepsy?
Well, at that particular time, I wasn't in my body enough to worry about whether my friends came or not. You have to understand, I was disconnected from this world in such a way that I lost intellectual information that I'd taken 18 years to gain. So I was kind of out of it, like a person who was really low functioning would be.
And what did the doctor prescribe to you as a treatment for your epilepsy?
Initially, I was placed on Dilantin, and I took Dilantin for, I believe it was 60 days. And at the end of 60 days, I had the Stevens-Johnson syndrome occur, which, because it was Dilantin, which is a long-acting drug, it progressed to level 10, which is life-threatening in Stevens-Johnson. And I was in the hospital quite a while trying to get over that, because it's like being burned in a fire. Your skin disappears. And so anyhow, after that, I recovered from that. I went on another anticonvulsant. I don't know which one. I think maybe it was phenobarbital at that point. That did not work, and it caused mood swings and personality changes that were unacceptable to my family. So I was taken off of that drug, and then I was moved to another one and another one. And then ultimately we ran out of drugs very quickly because there just weren't that many anticonvulsants available in 1965.
And your doctor told you that epilepsy is something you cannot control yourself. Your doctor told you that it's something you're going to have to learn how to live with.
Right.
And learn to live with medication. How did you feel about that whole situation?
Well, by the time I was told that, it was a year plus later after my hospital stay, so I was more with it. And I was devastated by that because at first, we had come to him, not first, but somewhere in the first year, we had come to him with the concept that maybe something I was feeling or thinking or doing might be contributing to whether or not these seizures occurred. But he said, nothing you think, feel, or do has anything to do with this, so just forget that. If the drugs don't work, nothing's going to work. And so we were really hoping that the drugs would work, but they didn't. And at the end of the drug trials, which included combination of the drugs, which took somewhere around 2 years to complete, I was told it was hopeless. And at that point I became very depressed.
So how did you cure yourself? How did you treat your own epilepsy?
Well, I had an insight in the moment of my deepest, darkest hour, that basically questioned what I had been told about the feeling, thinking, doing, and also about the brain damage being the only cause. Because the brain damage is there all the time and the seizures aren't. So something else, in my opinion, had to be interacting with it. That thought gave me hope. And that hope led to changing some things I was doing. It's like in America, you pressure yourself to learn, learn, learn. Like I was trying to re-educate for all that I'd lost. And I was very frustrated because the seizures would make you forget what you'd learned. And they were happening when I would get frustrated from not being able to learn. So it was a catch-22, a vicious cycle. I was being taken down a little bit every day from the process. And so one morning after I had that insight, I got up and I just said, I'm going to do it different today. When I feel overpowered, I'm going to walk away from it for a while and just see if I can calm down. And I did, and guess what? The seizure didn't happen that time. And even more important, the thing I was trying to learn, I learned while I wasn't even trying. And I went, I think I can use this. I think I can work with this.
So what was it that was preventing the seizure? Like what technique were you doing?
I walked away so I didn't push the frustration beyond the threshold.
Control your emotions?
In that case, it was definitely not becoming overly frustrated. And so that didn't add up to anything other than a momentary experience at that point. But a year later, when I was doing it with everything that overloaded me, like I'll give you an example. I had light as a trigger for seizures. Just the light in this room would have caused a seizure in the past. And what I did with that was something so brilliant, I can't even believe I thought of it, but it was also something a vegetable would see. And that was, I stood in a dark place and exposed myself to lighting at a controlled level until my brain accepted it and then, or overloaded from it, and then I'd pull away and give it a break, and then I'd come back to it. And we call that process in psychology systematic desensitization. We have a name for it. And I did that on my own.
And what do you attribute to your success?
I think figuring out how what causes seizures. That they are in fact caused. There is a cause and effect. Which, by the way, neurology does not know that. It does not ascribe to there being a cause and effect. And there is. And for, let's just say, in the temporal lobe, which is a very common place of damage, on the left side for most people, is your language center. A simple trigger and a frequent trigger for seizures is trying to remember a word. Because maybe you have a memory problem and your lobe won't call it up when you think you need it, and the act of trying to do that is an overload. Let's take another function. In the frontal lobe on the right side is a signal that tells you need to go, pee. Okay, and if you don't answer that signal right away, it becomes like an alarm going off continuously until the need is taken care of. I used to not answer that alarm right away because I'd get into something and wouldn't want to stop. And then have a seizure which involved incontinence because I didn't listen to that alarm.
Okay.
So that could overload you to the point of having a seizure. And the brain is running everything, so it could be anything. The trick is, the hard part, is figuring out what the thing is that is involved in your seizures.
So what specifically about your treatment is so effective in dealing with your patients?
I put it in their control to solve it by educating them about their functioning here, the brain, and their life in relationships to the onset of the seizures, and putting that information together to identify what triggers it and what warns them and what to do about it, which is called a compensatory measure.
Okay. What can you attribute to the success of your treatment? Why do you think it's so effective more than mainstream medicine? Like, we heard the presentations yesterday, and the numbers are astounding with how effective your treatment is and how many people, the percentage of people that have improved significantly after your treatment. Why is your treatment so effective?
Because if you treat the cause of something, literally the cause of it, then you have solved a problem. And the problem goes away.
So it's more of a holistic approach. You're making people analyze their whole life, their habits, their environment.
If they happen to be important in the cause. Sometimes they're not. Sometimes it's physical things, over-exercise. It can be a lot of different things as the brain is running everything.
So you take more of a psychological approach and analyze the person's whole holistic approach and behavior environment to understand what's causing the seizure.
Actually, the way I do it is I try to look at it from a brain point of view. I'm managing this person's existence. This is the brain's job, and it's running everything. And when I look at a case, I try to determine, first of all, where is this coming from? Their testing from neurology usually points to the area that it's located. Sometimes no, but most of the time, yes. Then I can go and I can say, well, this area handles these functions, so I can get very specific right from the start and hone in on exactly what is likely to trigger. How fun is that? And then treat it and say, this is what works with that. Okay, when you have more global damage, it's much harder. But mine was global, and I finally figured it all out, and it didn't even take more than 2 years to figure it all out. And I have it all under control and maintained it for 42 years. And once you know something about yourself, you are then responsible for it. Before I knew, it could just happen to me willy-nilly, and I didn't have to take any responsibility whatsoever. But once I knew, if I do this, it will cause that, it was my job to stop doing it.
And how was that? How did you feel when you first realized you can control epilepsy rather than epilepsy?
I was elated. It changed my life. I was, instead of wanting to find a painless way to die, I wanted to solve it and go on living. And so I did. And it led me to this place, which I had not intended to come, but it just was a natural outgrowth, I think, of what I had done.
So what is your intention? Where would you like to take your treatment?
I would like it to be universally used. I'd like it to be used before brain surgery, which alters a person forever. I'd like people to have a chance to remain whole and to then, therefore, and take control of their life so that they can go on and do what they came to do.
All right, just two more questions and we're done here. What advice do you have for people struggling with epilepsy?
Just don't give up. Do not give up, and do not take what is considered the easy way out. Nobody has your exact answer, not even me, but you, as the person with this, do. So, don't give up.
And one last question before I go. What do you think is the biggest hindrance in mainstream epileptic treatment nowadays?
I think there are a number of issues. Some of the drugs cause terrible side effects. Some of those side effects separate people from their own personality. Some of them make them want to destroy themselves, like some of the newer drugs have suicidal ideations as a side effect. I think that people have to have more courage, and the lack of courage may be the ultimate problem, because if you have something going on and you notice it and you communicate it, it needs to be taken care of. No side effect should be ignored. And I think if doctors are told, they get on it right away. If they aren't told, they have no responsibility in what happens to you. So I think the communication in medicine between patient and doctor needs to be encouraged more.
Anything you want to convey, any message you want to convey to people with epilepsy and are struggling to get whole?
Well, I think if they are interested in knowing more about this approach, they should try to get a copy of Epilepsy: A New Approach, which in the United States they can visit their local library, and every library system has a copy of that book, so they can just get it from the library.
What's the name of the book?
Epilepsy: A New Approach by Richard, last name Richard, no S, and Reiter, R-E-I-T-E-R, and which is Dr. Reiter, my partner. That book is full of information about this process. and I think they could make a decision about whether it would help them or not.
How many people have you treated so far in your lifetime?
2,554. It might be 56 actually, but it's pretty up to date at 54.
And they've all seen good advancements, good progress?
I don't know that I can say that. I think there's some that did not respond at all, but they also didn't do the work. And you have to do the work to get the results. I mean, you have to study. You have to make yourself a study. And and we've written a workbook that helps the person go through that process of discovery about self. And you have to be real honest when you answer the questions in that workbook. But once you do that, you have the information you need to solve the problem.
All right, that's a wrap.